It's good to be back with you again, and thank you for joining us for this week's presentation. We're honored to have with us Dr. Princy Kumar, the chief of our Division of Infectious Disease at MedStar Georgetown University Hospital. And Dr. Kumar also serves at our School of Medicine as Senior Associate Dean for Students. She has worked tirelessly over the past 18 months to serve patients impacted by COVID-19. Her contributions have been extraordinary, and we are so glad she could take time to be with us today. I'm going to ask her about the Delta variant and what we're seeing in our hospitals, the recent news regarding vaccines and boosters, and about how COVID-19 is impacting our families and children. Before I welcome Dr. Kumar to our conversation, I'd like to offer a few comments on our efforts at Georgetown to support our faculty and staff. Now, throughout the pandemic, we have been guided by a set of practical assumptions. I have reviewed these practical assumptions in some of our previous presentations, and I have described how they are shaping our response. Now, one practical assumption recognizes the different impacts that COVID-19 can have on members of our community. Guided by this assumption, we have established a few resources for our faculty and staff to address some of the impacts related to COVID-19. For the past year, we have provided dependent care assistance grants for faculty and staff who are incurring additional expenses related to dependent care, either child care or adult dependent care, as a direct result of the pandemic. Beginning this month, we have launched a new resource for faculty and staff who find themselves in need of backup child, adult, or elder care. We have partnered with Bright Horizons to provide up to 7 days of emergency backup care at no cost to our faculty and staff. Our Family Care Working Group provided important feedback in the development of this new resource. And as our workforce transitioned back to our campuses, we recently announced a transition grant initiative which provides a financial grant to our faculty and staff who may have incurred additional costs as they return to work on our campuses this fall. Over these many months, our faculty and staff have done extraordinary work, and these are just a few of our efforts to ensure we can support them as we continue to navigate the challenges of the pandemic. Now, to share with us her perspective on this moment, I'm honored to welcome Dr. Princy Kumar to our conversation.
Dr. Kumar, let me again express my deep appreciation to you for the work that you have done over these past 18 months and for taking this time to be with us today. We could not be more grateful to you and your colleagues for caring for patients and for teaching our students during this extraordinary time. So I'd like to begin by talking about the Delta variant, now the dominant strain of COVID-19 in the United States. I'd like to pose a few related questions and then invite you to share your insights. So what is different about the Delta variant compared with the original strain and the other variants we've seen? Do you think we will see it start to subside here in the United States as it did in other countries?
Thank you, President DeJoya. Let me start off with the first question you posed, and that is, how is the Delta variant different? I want to step back and say at the way the virus looks at it, it is a survival, it poses a survival advantage to the virus. What the virus wants to do is it wants to survive at all cost. So it mutates, that is, it changes at the level of the spike protein, and the spike protein is where it uses to attach to a cell. So it keeps slowly changing how it attaches itself, the proteins with which it attaches itself. And that is how initially we had the Alpha variant, then we had the Beta variant, and now we have the Delta variant. So it is, and when it mutates and changes to become, it gives itself a survival advantage. And so with the Delta variant, what we know right now, it is twice more contagious than the original variant. So if the original variant could infect 2 people, if you had the infection and you sat in the room, you infected 2 people, the Delta variant can infect 5 people. So that's why we say it is twice more contagious than the same. The reason it is more contagious is it can replicate well, much better, and so you have higher viral load in your upper respiratory tract, and so that's why you get, and so that's an advantage to the virus. So that's why it's more infectious, more readily able to transmit the infection. Now, you asked me a very important question. Are we able, it's a formidable foe, but can we get past it? And the answer is yes. And if I can give you, based on science, the evidence is even with the Delta surge, the vaccine is effective. The vaccine is very effective in reducing more severe infection. It is very effective in preventing hospitalizations and preventing deaths. It is less effective in preventing overall infection. So if I can give you a number that I hope will resonate with our students who may be listening in, if you are vaccinated, even with the Delta variant surging in the US, you're 5 times less likely to become infected. You're 10 times less likely to become hospitalized, and you're 11 times less likely to die if you're vaccinated, even with the Delta variant.
Thank you. Thank you. Now, we know that, as you've just shared with us, the vaccination continues to be very effective against the worst impacts of COVID-19. I have a few questions related to vaccination. First, could you talk about what we are seeing in our hospitals when it relates to vaccinated and unvaccinated individuals? If someone who is vaccinated has a breakthrough case, do we see differences compared with the cases of COVID-19 in unvaccinated people?
Yes, we do. So let's take overall. There's so much of information that we hear about breakthrough infection, but it's important for all of us to realize is if you're vaccinated, you have a breakthrough infection, you're much, much more likely to have more of a common cold-like symptoms. Your symptoms are more likely you have a sore throat, you have a runny nose. Many people actually don't realize that it's COVID because they don't feel sick. You don't have the fever, the cough, the shortness of breath. So you're much milder symptoms, but unfortunately, loss of taste can occur and loss of smell can occur even in the vaccinated people. Now, when they need, the second thing it does is if you're vaccinated, your chance of requiring hospitalization is dramatically lower. We also believe that even when you get sick, the vaccine may not have fully protected you from getting sick, but it actually diminishes the amount of time the virus is actively replicating in your body. And that's new information that we now have, that it actually diminishes the time of active replication in your body. And so with all of that, we believe that even though we are seeing breakthrough infection, we're not seeing very severe infection in people who are vaccinated.
Got it. Now, 2 weeks ago, the FDA and the CDC approved a booster dose of the Pfizer-BioNTech COVID-19 vaccine for certain populations. Could you talk about the factors that have shaped the FDA and CDC's decision?
Yes. So all of us have witnessed that the vaccine is very, very effective in preventing severe infections. But we all have seen that people can still get infected. It's just that they don't get very sick. And we don't want people even to get infected. And what we have seen is people who are older, and for this, I'm going to define age as greater than 65. People who are older are more likely to lose their antibodies and more likely to become infected. But what I like to convey is that this is not unique to the COVID vaccine alone. Even for other vaccines, like the pneumococcal vaccine, we have always known that as you grow older, one of the things that happen to you is your immune system is not as strong. And so even for COVID, now we know about the age of 65, over a period of time, the antibody titers can come down. So the FDA looked at the data that Pfizer presented and said, if you're about the age of 65 or you are in a long-term care facility, those are the two big groups of people that should get the third dose. The second group of people are people between the ages of 50 to 64 who have got underlying comorbid conditions, because if they get the COVID infection, they're at higher risk for progression, and we don't want that to happen. So those are the two groups that the FDA and the CDC has said should get the vaccine.
And just this week, the CDC has released urgent guidance regarding pregnant women and the vaccine. There's new data indicating that pregnant and recently pregnant women who contract COVID-19 are at increased risk of severe impacts. Can you talk about this new guidance and the data that is driving this new guidance?
President DeGioia, the information that we have increasingly seen in pregnant women is disturbing. There's no other way to see it. If I can put it very graphically to you, there are 161 pregnant women that have died. And just last month, 22 pregnant women have died. Just last month. That's even one that is too much, because overall they're younger, more healthier people. So 22 people the pregnant women died last month. And if you look at overall the statistics, only 31% of our pregnant women are vaccinated, only 31%. And we also know that if you get COVID and you're pregnant and you're symptomatic from COVID, you're 2 times more likely, twice more likely to need to go to the intensive care, to be put on a ventilator to breathe, and you're 70 times more likely to die. And this is because there are other infections also that pregnant women, for many reasons, do poorly. And COVID is just an infection that pregnant women and the immune system just are not able to deal with the infection. So this is why the CDC last month had actually come up with the guidance saying that if you're pregnant, if you're breastfeeding, if you're planning to become pregnant, get vaccinated. But given this 22 deaths just in 1 month, I think they felt the need to put it out there and to really urge the public and to urge pregnant women that it's actually safe. So it's not a question of not only protecting them, that it's actually safe for the pregnant woman and her unborn baby.
And let me ask you about children. What are we seeing when it comes to COVID cases in children? What are the important issues to be aware of, particularly as we wait to see when the FDA and CDC may make a determination about a vaccine safe for children?
So in children, even though we do see cases that they can get very sick, overall children actually get less sick with COVID than older people. They just tolerate it better. Clearly, there are some children that get this very bad multi-system inflammatory syndrome, but overall, they tolerate the infection reasonably well. It is just that they happen to be in closed settings, like in classrooms, where the ventilation may not be that effective. We all know our school systems, they may not have the most elaborate ventilation system. So, and they tend to have more children within the class. So this is the reason why the guidance came out that all children and all school teachers need to wear masking within the classroom. But overall, there's been some concern about the risk of myocarditis in children after the Pfizer vaccine. What I like to convey to anybody that is listening to the thing, yes, both the messenger RNA vaccine can cause this very unusual condition that's inflammation of the heart, that's called myocarditis, but it's extremely uncommon. It occurs mainly in young boys and young men between the ages of 12 to 26, that's the highest group, but they recover from it. And you're much more likely to get myocarditis, 16 times more likely to get myocarditis if you actually get the COVID infection. So I like to tell parents to get their children vaccinated, because even though the vaccine is now approved for children above 12, there is a significant amount of concern by parents that they're not vaccinating the children.
Sure. Oh, Dr. Kumar, I cannot thank you enough for taking the time to join us today and to share your insights with us. As we close our conversation, is there a message you'd like to share with our community?
I do, President DeJoya, and that is that there are people who are concerned and anxious about about taking the vaccine. How best can we as a community be non-judgmental, but still advance? Why is it that science has brought us this far? And from everything we have from science, these vaccines are safe and they are effective.
Thank you again, Dr. Kumar. And thank you all for joining us this week. I look forward to being back with you next week. Take care of yourselves and take care of everyone around you. For every Hoya, everywhere.